Welcome to our workshop tonight. This has been a special request because I find that I have done workshops on NSAIDs and non-steroidal anti-inflammatories and their impacts to our health and how they are black labeled by the FDA. And we've talked about spinal hygiene movements. We've talked about vital needs and how icing is not recommended at this point, right? And so I've had a couple people say, well, what can we do then? So this workshop was birthed from that, is really looking at natural pain relief. What is available? Let me make sure everyone's muted. Let's see. There we go. So what is available to us that naturally supports the body processes to provide some pain relief? So let's get started here. So first, I think it's important to understand pain. I mean, first, the question I always like to ask is pain bad? Like, do you think pain is a bad thing?
Well, depending on how bad it is.
Okay, so the level of pain?
Level.
Okay. What, anybody else?
A little pain, that's probably good because, you know, maybe something is going to start or.
Okay, so maybe it's a signal?
Yeah.
Okay. What do you guys think? Is pain bad?
I used to think it was really bad when I talk with you. It's evolving.
I think our healthcare system is really focused on pain and symptom management. And so we think pain to be bad. And I like to go to, so chiropractic was founded on 33 principles. And we have chiropractic principle number 20. A living thing has an inborn intelligence within its body called innate intelligence. Principle 21, the mission of innate intelligence is to maintain the material of the body of a living thing in active organization. So meaning to keep that system in a level of coherence and harmony, synchronicity, meaning that we have trillions of cells working in our body as one, and we want those trillions of cells to be working towards regulation of healing and homeostasis to keep our physiology in check. And when we think pain is bad, that's basically saying that your body is defective. It does not know what it's doing. Our body is wrong. When in fact, our body is very intelligent. Our body is self-healing, self-regulating, and our body is designed to maintain our existence, not just to survive, but thrive. So pain is really an intelligent response by our body, and oftentimes pain is the one that we really listen to. So first, I like to challenge people is if you have pain, to be curious, not judgmental. Okay, be curious about where did this come from? Why am I feeling this way? So I think it's always a time to pause and get in tune with your body, get quiet, get focused inward, and ask yourself questions in a loving way. Am I out of rhythm? You know, what is my body telling me? What do I need? What do I need to stop doing? Is there something that's shifted in my routine? I think that when we quiet down and we do some self-reflection, sometimes we start to see that there is a rhythm that's out of place. There is maybe a reason for our body to expressing itself in this way. So pain is a response of an intelligent body. The goal is to support your body and body processes and healing. And understanding if you're in pain, there is a greater issue at play. So we find that pain management, pharmaceuticals are meant to stop the body processes from creating pain or creating symptoms. But these symptoms are actually vital and very important for how our body heals and regulates. And before we get into some of the recommendations that I have if you're in pain and to manage that, I love this quote. I'm going to read it right from the screen. You can follow it with me. If you ever feel down, remember 100 trillion cells make up your body, and all each of them cares about is you. Our body is made up of about 100 trillion cells, all living, working, and sacrificing themselves completely for the exclusive benefit, well-being, and survival of the whole, which is you. We are each of us a universe unto ourselves. It's awe-inspiring to think that 100 trillion cells are counting on me also. My decisions determine to a large degree whether they are allowed to continue living and experiencing in this life or not. I love that quote because that quote, I think, puts into perspective that you are made up of all parts of you that are constantly working and striving for you to survive and thrive. So when we say negative things about ourselves, when we think negatively, when we hate how our body's expressing itself, you're hating you.
You should be given out of
I mean, yeah, I think everyone would benefit from listening and hearing these words. I mean, there is an army within you that is sole purpose is to protect you. It does not care about anything else. In fact, if you are foreign, it will do its job to get rid of you in the fastest and it will take massive response to get rid of anything that it does not recognize as you. So I say this because a lot of times when we're in pain, especially if we're in chronic pain, we can get pretty upset with our body. We can say pretty sad and horrible things about our body. And you have to understand that, and this, again, it's inspiring to think that these 100 trillion cells are counting on me also. I have to take responsibility. And so when it comes to pain, there's a bigger picture to addressing the pain versus just the pain management. And we'll talk about that in a second. But let's start with really some natural pain relief, okay? So some natural pain relief that I think would be a better alternative compared to an ibuprofen, a Motrin, an Advil, an aspirin, these NSAIDs, these non-steroidal anti-inflammatories, is using homeopathy, and specifically arnica. Some people have heard of arnica. Has anybody ever heard of arnica? After doing my research around arnica, I think I don't use it enough because there's some really wonderful benefits here. So arnica, it's best used for treating initial shock and trauma from injury. That can include bruising and hemorrhaging from an injury. That can include muscle aches from overexertion. It can be used pre and post surgery for head injuries, old injuries that are still bothersome. And I actually want to read you, I got this from this book. It's called, Homeopathic Medicine for Children and Infants, but if it's relevant for kids, it's relevant for adults. So let me just go to, see if I can find it, 147. So this is what the orthopedic surgeon, Robert Becker, strongly affirmed his success in using arnica in his book, Cross Current, stating, "In many years of orthopedic practice, I have treated hundreds of sprained ankles, provided that the ligament is not completely torn. And I have found that simply rubbing on arnica ointment within a few hours of injury results in practically instantaneous and complete relief of pain, a rapid and complete resolution of swelling, and a rapid, within 1 to 2 days, of disappearance of a blood clot. I know of no other agent, FDA approved or otherwise, that can match the efficiency of arnica in this respect." So that's from an orthopedic surgeon. And we know, and I'm going to read some of the things that are side effects of using the over-the-counter pain medications that we do use. Arnica is a wonderful homeopathic to manage the symptoms without all of the side effects. And when we're using something like a homeopathic that is meant to support the body's systems, to support healing, it's not meant to stop it from healing. Remember, ice stops things from healing. It slows the body's intelligence from doing its thing. NSAID stop the inflammatory process from happening, which is a cascade of events which brings, again, healing to the area. But it's not comfortable. So when you use a homeopathic, that's working with the body. So arnica. So primary indicated conditions: backache, birth trauma, bleeding, bruises, circumcision, eye injuries, fracture, head injuries, jet lag, muscle injuries, shock from injuries, smashed fingers and toes, sprains and strains, surgery and toothaches. So you can use these for muscle aches, sprains and strains. You can use it topically. So I just pulled this off of the internet. There are tons of, I think, brands available. I am not, stating that this specific arnica cream is the best ever, but there's arnica available. I would, and I didn't do my research to say what might be a best source to get your arnica, but I think Natural Grocer, I think Whole Foods, I think Sprouts generally carries good quality brands. But you can take it internally or you can rub it externally. If it is a head injury, we say you don't need anything external, you're going to use it for internal use. But if you do have broken skin, we don't want you to use it externally on that skin. For internal dosing, now again, if you want more details to understand this, this label, so typically you're going to start with, you see that 30C right there? That's the amount of times that this homeopathic has been diluted to make it effective for treatment. Okay. If you want to learn about a homeopathic, I have a whole book on that. But you would typically look for the homeopathic that's labeled 6X or 6C, 12X or 12C, or 30X or 30C. So you can see this one's 30C. Okay, and you're going to use that 3 to 6 times a day, depending on the intensity of symptoms. And I use these, I actually have these beads. These are beads at home. I have a homeopathic that I use for Margot when she gets croup. And I tell you, she starts to cough up and get that really hoarse cough. It takes care of it like that. It's amazing. But these are beads, and typically you can put it under your tongue and let them dissolve. And the dosing will say on the label what that dosing is. So for Margot, I'm using 5 beads. And depending on the intensity of her symptoms, I've given her beads every 20 minutes to up to every couple hours. So for arnica, it would be 3 to 6 times a day. And you see it. I mean, is it less intense? Maybe you're doing 3 and you're giving yourself those doses every 4 hours, right? During the first day of a condition, you may require dosing every hour to 2 hours during that first 24-hour period, and then dropping back to that 3 to 6 times a day. Acute pain, typically you get a degree of relief after the first night's rest. And then for chronic or reoccurring complaints, it can take longer and require additional care. And I think it's really worth mentioning, because I go back to that quote, those trillions of cells are counting on me and my decisions. There is really a lifestyle component here. If there is chronic pain that you are experiencing, or something that's episodic or cyclic that continues to show up in your body and your health, there's really a lifestyle and behavioral component that needs to be addressed, or else it will never go away. Okay, so that's my number 1, arnica. It is a great natural pain reliever. And it can be used for a lot of things. You can have topical creams and you can use it internally. You can use both at the same time, depending on what you're experiencing. Okay, so if you stub your toe, or if you sprain your ankle, or if you're in a car accident, or you have surgery coming up, or post-surgery, you can use those things, right?
I'll be at Whole Foods tomorrow morning picking up some.
Okay, so my next, I guess, natural pain reliever that I recommend is some specific supplementation. So this first one I mentioned was omega-3 fatty acids or fish oils. And I bring this up because I've got a bunch of studies right here that have looked at how fish oils compare to NSAIDs. And this is looking at people who were working with a neurosurgeon for their pain. And they found that people who are on between 12 and 2,400 milligrams per day of fish oils, within 75 days, 60% of people discontinued taking their prescription NSAID medications for pain. So they actually didn't even need their prescription meds. 60% of people. That's significant. 88% stated they were satisfied with their improvement and they would continue taking their fish oil. And there were no significant side effects. Because we know the side effects for NSAIDs are horrible. More than 70 million NSAID prescriptions are written each year, and 30 billion over-the-counter NSAID tablets are sold annually. Let me go back here. Make sure I keep. Almost all patients who take long-term NSAIDs will have gastric hemorrhage. 50% will have dyspepsia, which is more stomach issues. 8 to 20% will have gastric ulceration, and 3% of patients develop serious GI side effects, which results in more than 100,000 hospitalizations, an estimated 16,500 deaths, and an annual cost to treat complications that exceed $1.5 billion. So when you start addressing the inflammation within your body by using something like a fish oil, long term, you may not necessarily need to turn to your over-the-counter meds. Now, the most benefits you're going to experience is if this is used long term. And I think it's worth noting that when it comes to fish oils, this is the healthy fats from fish and flaxseed oil. Its counterpart is omega-6s. That is found in lots of processed foods, seed oils. The anti-pain zone is if we're consuming 4 omega-6s to every 1 omega-3. That's anti-pain. If we're in that healthy ratio, then we don't experience pain. Well, guess where the average American is? 25 to 1. They're consuming 25 omega-6s to 1 omega-3. That means it's a highly inflammatory lifestyle. So I bring this up because if you are only taking fish oils and not changing anything else, you are really just treating it like a Band-Aid. You need to address the lifestyle choices that are creating a lot of the inflammation and stress within your body. So this is going to be a chronic thing. And I'm using, pain as the topic tonight, but you can, insert anything here. Chronic disease is running rampant in our country, and it is lifestyle choices, inflammatory, we just have a highly inflammatory life, very toxic, and we're deficient in a lot of healthy things. So fish oils are going to be great for long-term use. And if it is more of a chronic pain you're experiencing, you really need to build that up in the system. So it's not going to be like taking an aspirin, the pain's going to go away right away. This is something that builds up over time. I also like magnesium. You can use it internally, and you can use it topically. Especially if you're experiencing any type of musculoskeletal stress, we like to have you get an Epsom salt bath. Epsom salt's a great source of magnesium. When you are tired, fatigued, your muscles are rigid and tense, it's usually a sign of magnesium deficiency. And so by you soaking in a bath, usually 1 to 2 cups of Epsom salt, you can add some lavender essential oil if you want some calming effects. But your body will directly absorb that and it'll help relax your tissue. It'll feel good. It'll calm you. It'll prepare you for rest and sleep. And so I really like magnesium. You can do baths 3+ times a week. Also, you have that heat. So there's a heat component that, again, supports circulation and getting blood flow to the area. Magnesium is, oh, I should have included this because there's lots of different magnesium types that you can take internally that will help support muscle fatigue, tiredness, pain, spasm. I'll have to put a note at the end of the video or at the bottom of the video on the YouTube channel so that I make sure you get the right magnesium for that. So there's magnesium glycinate, there's magnesium citrate, there's magnesium chloride, and I want to make sure you know the one for pain relief. So, okay. So next, I think essential oils can be really wonderful for topical application. Peppermint is one of my favorites. It's a stimulant. It is antispasmodic, it's antiviral, antimicrobial, antifungal, and antioxidant. It soothes nausea, improves concentration and memory, improves circulation, and is analgesic, meaning it takes pain away. You can use it primarily for musculoskeletal spasm, fatigue, pain, nerve pain. I even have read accounts where there's neuropathy going on from a woman who had to have multiple lumbar spine surgeries or low back surgeries and had complete loss of nerve sensation to her leg. And she used peppermint essential oil, and she said her nerve sensations started coming back. And so, but this can be really wonderful. Some people like to use lidocaine patches. You can use a couple drops of peppermint with some coconut oil or some olive oil or avocado oil, and you rub it right into that area. You can apply it, every 2 hours to give you some relief. It can really give you some nice relief instantly and used regularly. Again, when you're using an essential oil topically, it's just making sure it's not too intense for your skin. So you want to dilute it down. So I really like, for acute scenarios, I like peppermint oil. Now, if it's more chronic, thyme and basil can be a wonderful combination to use in larger areas and also at bedtime. So thyme is anti-inflammatory. It actually is shown to act similarly as an NSAID when it blocks that COX an inflammatory process. Basil is antioxidants, calming, uplifting, eases muscle and joint discomfort, supports overall well-being. So you can use this. I would use this at night, put 1 to 2 drops of basil and thyme, put it with coconut oil or whatever oil you have, and just rub it where you feel the pain. If it's the low back, if it's the knees, if it's the ankles, just use it where you feel the pain. Peppermint is a stimulant. So some people, if they use it at night, it's going to wake them up or keep them up. So that's where if you use peppermint in a more acute scenario, I'd use it during the day and use something like this at nighttime. Okay. And again, we use Young Living. We also have doTERRA. Doc really likes doTERRA. We like those companies because we know the quality of the oil. So the biggest thing is these are not, I think maybe basil is $30 here. It's a 0.5 fluid ounces. Thyme is, I think, 50. They are a higher quality, so they will cost more than something you would get maybe at a grocery store, but you need less of it. So using 1 to 2 drops, this could last you 6 months or maybe longer. Okay. And my next recommendation, movement. The days of resting and being sedentary because you are hurt or in pain or injured are over. Okay? No icing and no, there are time frames where that is necessary. But if you have a sprain strain, or if you have injured your ankle, or if you've had knee surgery, they're still moving that knee right after surgery. So movement is a part of healing. And if we're not moving our spine or moving our joint in a healthy way, and again, you've got to use your common sense here when you're moving these joints, right? If it's, say, a sprain strain of your neck, I'm telling people, no, I don't want you icing. Yes, get adjusted. Use your peppermint. You use your arnica, and take that spine through your range of motion as well as you can. So if let's say you're turning your head right to left, maybe your motion's right here. That's okay. You're still working the tissue. You're engaging the tissue. It's been injured. Movement brings input to the brain. It brings circulation and blood support. It helps support tissue healing. So you need to be, and again, maybe lateral bending is right here. Maybe flexion and extension is right here. But you need to move the joint, whether it's a spine or it's an ankle or it's a pinky or a toe. You need to be moving it. Rest is important. But you can't, here's the thing. Let's say we sprain an ankle. Then we don't do anything on the ankle in 6 weeks. We're resting it. We're doing absolutely nothing. And then we want to go out and do what we did before we sprained the ankle. But we have not prepared that joint to handle that input. So as it's healing, we've got to incrementally increase the stress to that joint so that it can return to activity. Not only that, but return to increased activity to handle life. Movement is life. We cannot stop moving. Once you stop moving, that is death.
Yeah.
So when we're talking about rest and recovery and pain, you know the difference between pain that's hurting you and pain that's, it doesn't feel good, but it's part of healing, right? You got to use common sense here and listen to your body. But yes, rest, support your body, listen to your body, support it with its healing, but then you've got to work to get some movement when you're able. So that's where, I have people, I think I told somebody a couple weeks back, I crashed my bike and I literally, when I jarred and hit the ground, I strained some of my neck. I was like, oh my gosh, it was terrible. The first 3 days didn't have great range of motion, but I just kept working it. And I was like, okay, I know I need to motion it. And even I was working through here and I was just doing some pressure points and working through these muscles, just motioning that movement. And I think my recovery was significantly better than what it could have been if I wasn't doing those movements. And of course, I was getting adjusted and doing the things that you do regularly and consistently, but you've got to up the ante when you're injured. You got to support your system in a better way. And then this last slide here, additional things I would add. If it is acute and you've injured yourself so much that your body is having trouble managing the swelling or managing the inflammation, I think ice and heat are appropriate in combination. That's only if you are swelling up like a balloon. So you can use ice and heat. So that's helping the body bring blood flow to the area. It's not stopping inflammation. And you're going to be using heat to, you're going to stop with heat. Okay. And if it's still having trouble with inflammation, you're going to take your hands or your thumbs or your body and you're going to work that tissue. Let's say my wrist is swelling up and I've done ice and I've done heat. I'm going to work and help my lymphatic system with some massage going towards my heart to help my body handle that inflammation.
Yeah.
If you've heard of kinesio tape or K-tape, this is a picture of a box of KT tape or a person who has tape here. That is not like the athletic tape that you maybe used back in the day, where the athletic tape or a brace would just do your body's job. Kinesio tape is actually supporting the muscles, it's stabilizing the muscles, and when you go through your ranges of motion or go weight bearing, it's just providing some level of support. So it's really great in acute situations where you're like, oh, I got to move or I got to sit. You just need a little extra support, but it's engaging your muscles to do the job. And then I would say hydrate. Make sure you're drinking water. This is not the time to be drinking alcohol, pops, juices. Sugar shuts down your immune system. It shuts it down. And an injury is, your immune system is like priority to be, all cylinders are firing to take care of your health, right? Your 100 trillion cells are looking to the immune system to say, what do we got to do? And of course, your immune system is made up of some of those trillions of cells, right? But they're looking for directives. And if your immune system is down, if it can't provide proper communication, then that impacts how well you heal. So I hope tonight, I'm really sorry I started late, but I hope tonight I provided you with some options for pain management that helps support the body's ability to heal. You know, of course you are, I didn't write this in here, but of course you're getting adjusted. When you are injured, you get adjusted more. That means your body is out of rhythm. It's not in a maintenance type frequency of care. It needs more support and more care to get you through, right? So you don't stop doing the things that you know to do that are healthy. You continue doing those, maybe even up the ante in that, and then add these other components. And you on the outcome of hurting yourself will be at a different state, right? You'll be in a completely different state. So thank you for being here tonight. I hope it was
This is
good information to support you in your life journey. And I just want to end it with this. I think it's worth, hold on, I think it's worth going back here. We just all sit with this. If ever you feel down, remember 100 trillion cells make up your body, and all each of them cares about is you. And those 100 trillion cells are counting on me, my decisions to determine to a large degree whether they are allowed to continue living and experiencing in this life or not. When they are doing well, you are doing well. And all their job is to keep you well. So that's why this is the mode. This is where you start. Be curious. Get in tune. Ask questions. Don't numb yourself. Don't get disconnected. This is the time to connect. So love and appreciate you. Thanks for being here tonight. And I look forward to seeing you in the office. So.